Hey guys, Dr. Ford checking in with you in this coronavirus pandemic. So lots of information, lots of news this week, right? We took the lead in the world for number of cases, and as of today, we're at about 142,000 cases with about 2,500 deaths. Scary stuff, right? I want to make sure you stay informed though, so we don't panic. And look, this number of cases increasing is from two things. First of all, we're catching up on testing. We're still way behind and we're falling short on the amount of tests and the availability of testing, but nevertheless, we are doing everything we can, it seems, to catch up on testing. So that's one reason for the spike in cases. Number two, yes, it does continue to spread. We have to assume that. We can't just think that this is going away and we're catching up on cases, because that mentality might lead to more cases happening. And we're going to talk about this, so stay with me. Also, the task force came out today and extended these recommendations, these guidelines, through the end of April. And what does that mean? It means we need to continue doing our social distancing, our self-isolating if we have symptoms like cough or fever or just not feeling well. And we need to self-quarantine, meaning stay home for 14 days, don't go to the store, don't go out and walk if you think you've been around somebody that ended up testing positive for this disease. So let's take a big step back and let's again revisit the topic of self-isolating, social distancing, self-quarantine, and why it's important. I've been getting a lot of questions, a lot of comments that have to do with, the effects of this infection, COVID-19. I'm young, I'm healthy, why do I need to worry about it? Or, what if I don't have any symptoms? If I don't have any symptoms, I don't need to get tested, you're probably hearing. So it's kind of natural, it's logical to think, well, therefore, I don't need to self-isolate or quarantine. I don't need to take it as serious. I don't need to be that strict on myself as, if I were coughing and had a fever. Not true, guys. One of the most dangerous things about this disease, and the reason it's been able to get such a foothold, right, around the world and become a pandemic, is because someone can be walking down the street, your neighbor, your friend, your brother, your sister, have absolutely no symptoms at all, and still spread the disease. And God forbid they spread that disease to someone with an underlying medical condition, which we're going to talk about, or an older person, someone older than 65, because these are the people that are more susceptible to the more serious complications of this disease. And keep in mind, we are seeing more and more cases of young, otherwise healthy people having very serious complications, needing hospitalization. Some people are dying from it that are otherwise young and healthy. So it's very important, both from the standpoint, as I swallow my words, both from the standpoint of keeping yourself healthy, but also from the standpoint of keeping your community healthy. We are a united nation. We need to treat each other, whether you live in California or Ohio or New York. We need to treat each other like neighbors. We need to treat each other like family. And we need to look out for each other. And the best way to do that still is to practice social distancing, okay? To this day, as we speak, there still is no treatment. There's no cure. There's no vaccine for this disease. Yes, we're absolutely doing everything we can in the scientific community to change that. We're working on a vaccine, but that could be a year away from now. We have trials underway. These trials got pushed through very quickly, which is great, but they are trials. That does not mean that something like hydroxychloroquine is a treatment for this disease. We have to do these studies. We have to make sure it's effective. And number two, we have to make sure it's safe. And some people will say, well, we know it's safe. It's been used for, years and it treats malaria. Well, let me just try to break that down and make it kind of tangible for you and digestible. When we go through FDA approval for a drug, we use it in a specific way, a specific dosing, in a specific type of disease or population, and we know the safety profile and the effectiveness for it within that kind of sphere or that circle of people, right? When we start using it off-label, that's a whole different ballgame. Maybe the dosing's different. Maybe the side effect would be totally different for someone who has a pneumonia that we get with COVID-19, like we get with coronavirus, than someone who doesn't have pneumonia. Maybe malaria is okay. The side effect profile is okay with hydroxychloroquine, but if you have pneumonia, if you have a different type of infection, it may affect you differently. So if you can understand that, then you can kind of logically take the next step to understand why we need to do these studies first. But please, again, trust in the medical scientific community. These studies are underway, and you better believe if we see a benefit and we see safety and effectiveness, we're gonna get that thing out there just like that. So again though, nothing as of today is an effective treatment or a known cure or vaccine for this disease. The best thing we can do is self-isolate. So I wanna really touch initially and very importantly on the topic of young people and the idea of people that are only older and with pre-existing conditions being at risk. We are downplaying the definition of pre-existing conditions. When I say we, I mean all of us. I'm not talking about the scientific or the medical community. I mean all of us. I want to put that in perspective for you. So in America, we have a little bit of an issue with obesity, diabetes, high blood pressure. Well, guess what? 2 of the 3 pre-existing conditions that might make you more susceptible to death, hospitalization, some of the more serious complications of this disease, cardiovascular disease and diabetes. Guys, it turns out that 1 in 3 Americans, 1 in 3 are pre-diabetic. They're on the verge of diabetes and we don't even know it. Obesity is an incredible problem in the United States and around the world. But if you're obese, there's a chance that you might have pre-diabetes leading up to diabetes. You could have high blood pressure your whole life and not even know it unless you're going to your doctor regularly, checking your own pressures regularly. And why do I say that? Because high blood pressure over time can lead to coronary artery disease, which is one of the pre-existing conditions. I have to admit, I even caught myself in the beginning. Pre-existing conditions, we get this picture in our head of someone that's sick, they have to go to the hospital a lot, they're a special case, it's someone who's very ill, they're always on medications. That's just not the case with this disease, guys. So like I said, cardiovascular disease, much more common than you think. Diabetes, pre-diabetes, much more common than you think. And the problem is, just like the coronavirus, we talk about being silent and you can pass it on without symptoms. Well, we in the medical community think about diabetes, pre-diabetes especially, but diabetes as well, and high blood pressure or coronary artery disease. These could be very silent. These are silent diseases, almost more so than any other disease that we experience in this chronic, widespread fashion. So you can have diabetes, you can have high blood pressure your whole life and maybe not even realize it until you have that complication. So keep that in mind. Look around at your family, look around at your circle of friends and your neighbors, and just keep in mind that 1 in 3 or even 50%, if we combine all the statistics, could potentially fall under this umbrella of pre-existing conditions. I want to really make sure that we understand that and we digest that. So why am I telling you all this? It's not to just spout data out at you. I really want to drive the point home, putting all of this together, right? There's no treatment other than self-distancing, social isolation, and there is no, the pre-existing conditions are not some red herring. They're not the sickest of the sick, the oddest of the odd. They're walking amongst us, right? They're our friends, they're our neighbors, they're our family. So bringing it all home, please continue to social distance as much as you can, right? And then some, as much as you can and then some, right? Take this time to grow a little bit, take on that project that you've been waiting to take on, explore the language you've been waiting to learn, and make sure that you explore all of the support that's available on the city, state, and federal level from our government to help catch, the fall, right? To help give us that safety net we need so that we're not destitute, broke, and totally on our own, because we're not. So I'm going to continue to answer your questions. I love hearing from you guys. Please feel free to reach out. Until next time, I'm Dr. Ford. Be well. We'll edit out the end there because it was fucked, but
Let's say it again.
Okay.
What do you want to say? Anything about the ending? What didn't you like about it?
I don't know. It didn't seem right. Did you think it was okay?
I thought it seemed great. Just say in good health.
No, that's fine, man.
Be well. Be well. I thought it was great.
Okay.
Dude, I thought it flowed.